Number four of the seven key principles, it will be oxygenation, oxygen therapy. We know that cancer is a hypoxic disease, right? Tumors will grow, will initiate, will progress, will replicate, will metastasize in a hypoxic or low oxygen environment. And this is from the works of Dr. Warburg, where respiration at the mitochondrial level is decreased in patients with cancer and chronic disease. So really working at oxygen at the cell level is a big key, because thereby having good cell membrane potential of the membrane of our cells, we can have better oxygenation, better hydration, better nutrient absorption at the cell level, and also better elimination of toxics and byproducts of metabolism, right?
Okay.
Because the cell membrane is so critical. The acceptable ideal cell membrane potential is 70 to 90 millivolts. That's so in children, but as we get older or more experienced in our life, as they say, this cell membrane potential decreases. In cancer patients and chronic disease patients, this cell membrane potential could be 15 millivolts, considering a normal being 70 to 90 millivolts. Very deficient immune, cell membrane, right? So it leads to many chronic diseases, and we have to remember that cells make tissues, tissues make organs, organs make the body systems, right? The respiratory system, immune system, and then all these systems together compose the body. Typically in medicine, we focus on the organ, right? The liver, the pancreas, the stomach, but we need to focus and break that paradigm and think about the cell, right? Because the cell is the basic unit of life, and that's where everything starts and ends, right? So oxygenation is a key principle in our cancer therapies. The next one will be antimicrobial factors. The more we know about pathogens, whether they're viruses, bacteria, fungus, parasites, and the role they play, right? The most well-known is the H. pylori and its association with stomach cancer, right? Gastric cancer. And there was some studies done that they think that 15% of the world's diseases, and particularly chronic disease, is due to pathogens, you see. And to that end, Hope for Cancer has a collaboration with a group out of Utah where we have something very exciting happening in our efforts to affect the microbial world. So then the next key principle will be, of course, a spiritual, psychological, biological aspect of health, right? Because we are truly, as they say, the body, mind, and spirit. And even in ancient Greek and Egyptian times, when someone went to a health facility, the first person they saw was the spiritual advisor, the minister, the rabbi, the monk, you know. And then they saw the psychological counselor. And then Scott, at the end, it was us. You know, we were at the end of the hallway by the bathroom, and that's the importance they gave to health. So it was the spirit first, the mind, the thoughts second, and then the physical body. So at Hope for Cancer, we're trained in something called recall healing, where we look for sudden, unexpected traumatic shock experiences that the patient or the person wasn't ready for, nor did he or she have a solution for. So an example, my mom doesn't like me to say this, but as an example, my mom, being Latin, she has been very possessive. So throughout my life, every day I have to call my mom. And if I don't call her, you know, I hear it the next time. And so this is the baggage that I've had to carry throughout my life. And I was in a workshop learning about recall healing and letting go of our stuff, right? The stuff. So the idea is to know it, to claim it, and then to let it go from a biological perspective. And so things happen in this process that I went through. And after I did this work, it's changed. It's changed me principally.
Mm-hmm.
And I don't really understand from a medical scientific point how it works, but it's like my mom gets it now.
Hmm.
And it's strange, but I've experienced it myself. And I could tell you hundreds of testimonials about this and physical manifestations of how tumors and conditions could improve almost with like quantum leaps when we get rid and let go of our stuff, our emotional, biological. It's more than emotion, it's biological. For example, Scott, a patient with left breast cancer as opposed to a patient with right breast cancer. Left breast cancer is associated more with mother-child conflict, whereas the right breast is associated with male figure. So always, always, always in our patients, we work on this, and inevitably, if someone has left breast cancer, the sudden, unexpected, emotional, traumatic shock experience has to do with a mother-child conflict, where it was them as a mother or them as a child to, to their mother. And conversely, for the right breast, it is always a male figure involved, whether it's the father, the grandfather, a teacher, when they were in school, something that was a male figure's very strong traumatic experience, right? So dealing with the biological aspect, the psychological, the spiritual is another of the key principles in our approach. And then, of course, the seventh key principle is the immune system, right? Immune optimization, because we know that the immune system protects us from a cold and cancer and everything in between. So that, in a nutshell, is how we approach our philosophy in approaching cancer. And mind you, Scott, not only cancer, but health in general. Because of this seven, only one is for someone with cancer. That's a non-toxic cancer therapy. The rest apply to all of us. Sure. And any of your viewers that are watching this or listening to this, it really should be a wake-up call that we do have to do 6 of these 7 principles: oxygenation, detoxification, antimicrobial therapy, boosting the immune system, nutrition, and the emotional, biological aspect of disease. And I think that if we do this, we're far ahead of ourselves in not being part of the statistics. We know in the U.S., right, 1 in every 2 males will have cancer, 1 in every 3 females. So we could be not part of the statistics, and prevention is the key.